6 types of back pain and how to know if they're linked with the liver, kidneys, or lungs. Have you ever felt a strange pain in your back and wondered, is this just a pulled muscle, or could it be something more serious? While most back pain comes from strained muscles or poor posture, sometimes it's actually a warning sign from your internal organs. Your kidneys, liver, or lungs can send out distress signals that show up as back pain, and recognizing these signals could be the key to catching a serious condition early. In this video, we'll explore 6 different types of back pain and how to tell if they're connected to something deeper inside your body, like an issue with your liver, kidneys, or lungs. By the end, you'll understand which symptoms to watch for and when it's time to seek medical help. Let's dive in. 1. Back pain when coughing. Back pain that intensifies when you cough, sneeze, or take a deep breath is more than just discomfort. It can be a signal that something serious is going on inside your body. This type of pain is often sharp or stabbing and may be linked to inflammation or infection in your lungs or kidneys. When it comes to the lungs, conditions such as pneumonia or pleurisy, an inflammation of the pleura, the lining around the lungs, can cause pain that radiates to the back due to the way the lungs expand and contract with each breath. As the pleural space becomes irritated, any increase in lung movement, like coughing or sneezing, can trigger pain that seems to originate from the back. On the other hand, kidney infections or kidney stones can also cause pain that worsens with physical movement or pressure changes that occur during coughing. This pain may be felt deep within the flanks or lower back and often doesn't ease with position changes. Accompanying signs that suggest a more serious cause include fever, chills, shortness of breath, dyspnea, burning during urination, increased frequency or urgency to urinate, or cloudy or blood-tinged urine. If you're experiencing back pain that gets worse when you cough and it's paired with any of these systemic symptoms, it's critical to seek medical attention promptly for accurate diagnosis and treatment. 2. Lower back pain. Lower back pain is one of the most common health complaints worldwide, often associated with muscle strain or spinal problems. However, when this pain is located just above the hips or along either side of the spine and doesn't improve with rest, it could indicate a kidney-related issue. The kidneys sit just under the rib cage on both sides of your spine, so kidney inflammation or obstruction can mimic musculoskeletal pain. Conditions like pyelonephritis, kidney infection, or renal colic from kidney stones often manifest as a deep aching or throbbing pain that radiates downward toward the groin or lower abdomen. Unlike typical muscle-related back pain, which can fluctuate with movement, kidney pain tends to persist regardless of posture or activity level. You may also experience additional signs like burning urination, hematuria, blood in the urine, fever, chills, nausea, or an urgent and frequent need to urinate. In cases of kidney stones, the pain can be excruciating and come in waves, described as colicky. If lower back pain is accompanied by these symptoms, it's more than just a back issue. It could be your kidneys signaling distress, and you should consult a healthcare provider immediately for further evaluation. 3. Flank pain. Flank pain is discomfort felt on one or both sides of the body, typically in the area between the lower ribs and the top of the hips. While this region is often dismissed as an area affected by poor posture or physical overexertion, persistent or sharp pain in the flanks is commonly linked to kidney problems. Kidney stones, urinary tract infections, UTIs that have spread to the kidneys, or hydronephrosis, a condition where the kidney swells due to a buildup of urine, can all cause flank pain. This type of pain can vary from a dull, constant ache to sharp, shooting discomfort that may radiate down to the groin or even the inner thighs. Other symptoms that point to a kidney origin include nausea, vomiting, fever, chills, and noticeable changes in urination, such as cloudy, foul-smelling, or dark-colored urine. Because flank pain can indicate a serious issue like a kidney infection, pyelonephritis, or even a blocked ureter, it should not be ignored. According to experts like USC's Keck Medicine, any unexplained or severe flank pain, particularly when paired with systemic symptoms, should prompt immediate medical attention to prevent complications such as kidney damage or sepsis. 4. Upper right back pain. Pain in the upper right section of the back, particularly below or near the right shoulder blade, can sometimes point to liver problems rather than spinal or muscular issues. The liver is located in the upper right quadrant of the abdomen, and although it doesn't contain pain receptors itself, it can still produce pain signals when it becomes inflamed or swollen. This pain is often referred to the back or right shoulder area due to shared nerve pathways. Liver conditions such as hepatitis, fatty liver disease, liver abscesses, or even tumors can cause this kind of discomfort. The pain might feel like a dull ache or a persistent throbbing sensation that worsens after eating heavy meals or drinking alcohol. In many cases, it is accompanied by other symptoms like jaundice, yellowing of the eyes and skin, fatigue, nausea, loss of appetite, abdominal swelling, or a feeling of fullness in the upper abdomen. These warning signs suggest that your liver is under stress or experiencing disease. Because liver issues can be silent and progressive, upper right back pain that coincides with these symptoms should never be overlooked. Early diagnosis can make a significant difference in treatment and long-term health. 5. Mid-upper back pain. Pain in the mid to upper back, especially around or just below the shoulder blades, may be easy to dismiss as a result of poor posture or tension. However, when this type of pain comes on suddenly or is accompanied by respiratory symptoms, it may be tied to lung conditions. The lungs extend toward the upper back region, and diseases that affect them, such as pneumonia, pleurisy, pulmonary embolism, or lung cancer, can manifest as pain that radiates to the back. This pain is typically sharp or stabbing and may worsen with breathing, coughing, or even speaking. In cases like pleurisy, the pain stems from inflammation of the pleura and can become more intense during inhalation. Other warning signs of lung-related back pain include shortness of breath, persistent cough, wheezing, coughing up blood, chest tightness, and unexplained weight loss. When these symptoms present alongside back pain, particularly in people with a history of smoking or chronic respiratory issues, it is essential to seek immediate medical attention. Mid-upper back pain should not be ignored when it's paired with signs of lung distress. It could be an early indication of a life-threatening condition. 6. Referred shoulder pain. Referred pain is a fascinating yet alarming phenomenon where pain is felt in an area distant from the actual source of the problem. One of the most common examples is shoulder pain that originates from internal organs like the liver or lungs. Pain in the right shoulder may be a sign of issues with the liver or gallbladder, while left shoulder pain can be associated with lung problems, particularly when the diaphragm is irritated. This occurs because the nerves serving these organs are connected to those in the shoulder region via the phrenic nerve. When the diaphragm becomes inflamed due to conditions like liver disease, gallbladder inflammation, cholecystitis, pleurisy, or lung tumors, the brain mistakenly interprets the pain as coming from the shoulder. This type of pain is typically dull and persistent rather than sharp or localized, and it doesn't respond to typical shoulder treatments like ice, massage, or stretching. Other accompanying signs may include shortness of breath, abdominal discomfort, jaundice, nausea, or chest pain. If you're experiencing unexplained shoulder pain, especially when no injury is involved, it's important to consider an internal origin and consult a doctor for appropriate imaging and diagnosis. Back pain is incredibly common, but not all back pain is created equal. While muscle strains and spinal issues often come to mind first, it's crucial to understand that your back can also act as a warning system for deeper, hidden problems involving vital organs like your kidneys, liver, or lungs. These organs don't always cry out for help in obvious ways. Instead, they might send pain signals that show up in your back, shoulders, or sides, disguised as something ordinary, but pointing to something far more serious. When back pain comes with other symptoms, like difficulty breathing, changes in urination, unexplained fatigue, fever, digestive discomfort, or jaundice, it's your body waving a red flag. These aren't just aches to stretch away or sleep off. They could be signs of an infection, inflammation, or even an organ dysfunction that requires immediate medical attention. Recognizing these subtle cues early can be the difference between catching a problem while it's still manageable and facing a more advanced, harder-to-treat condition later on. Your health is too important to take chances. Always pay close attention to how your pain behaves and what other symptoms come with it. Listening to your body, connecting the dots, and seeking the right help when needed isn't just being cautious. It's being smart. If you found this video helpful and learned something valuable about your health, hit that like button, share it with someone who might need it, and subscribe for more clear, actionable health content. We're here to help you understand the signs your body is trying to send, so you can live smarter, healthier, and with greater peace of mind. Thanks so much for watching, and as always, take good care of yourself.